Hello.
Good afternoon, everyone. So, after the lunch hour, we are starting with some kind of a very nuanced discourse on distress and drought, unlocking the mental health impacts of drying, desertification, and land degradation. This is a topic we are still trying to unpack. Droughts are emerging as a hidden mental crisis, extending beyond the environmental impacts to create profound social and psychosocial psychological challenges. This critical issue has disproportionately impacted agriculture dependent communities, vulnerable groups, indigenous people, where the economic strain of crop failures, livestock loss, cultural loss can lead to financial distress, unemployment, and social isolation. With that said, we have also been following the research that indicates that prolonged drought exposure and land degradation can trigger a range of mental health issues, including anxiety, depression, and even suicidal thoughts. Farmers and particularly rural communities are particularly vulnerable to this distress during the first 2 to 3 years of drought conditions. And I think this is a little bit of a pretext. And with this, I like to first introduce myself and then my panel so we can get into a dialogue on unlocking and unpacking the mental health, drought, distress nexus, and hearing insights from various regions and context. My name is Nidhi Nagabatla. I'm a climate scientist at United Nations University in Belgium and the cluster coordinator for nature, climate, and health, where we also look at climate change health nexus. Joining me today is the set of panelists, as you can see on the screen, covering a diverse range of geographies and thematic context. And I'll ask them to introduce themselves. But before that, I'd like to maybe first start give audience to my colleague, Dr. Sane Okamoto, to give us a brief overview of the work we have done so far at United Nations University, and thereby also share some thoughts on droughts and mental health nexus.
Thank you very much, Nidhi. I'm Sane Okamoto, senior researcher, psychologist, and behavioral scientist at the United Nations University. My campus is located in the Netherlands. We have 13 different campuses across the world. And because of the geographical proximity, my colleague Nidhi, who is located in Belgium, and the other colleague, Irfan, he is located in Germany. We have been collaborating after the 2021 European flood, we have been working on the topic of disaster risk reduction, and very importantly, we were looking into the psychological toll the people, the population who suffered from the disaster-related event, and also the aftermath. And so we published quite some papers and articles and blogs and so on that try to address this the mental health, how much climate change impacting our mental health, and also the not only related to that as climate change as it is, but also like the news information you get, but also direct impact from a disaster, but also like a slow onset of drought and water scarcity, all types of the impactful event that are like impacting our mental health. And one of the like milestone publication we made was the policy brief series. We published 3 pieces of policy briefs. First one is focusing on multiple and the complicated and aggregated impacts on mental health by climate change. And the second one more focusing on the risk factors, vulnerability and inequalities. As you know, every government has, allocated some budget to the health system, but still the problem is, quite modest amount of budget allocated. Within that, the health budget, most of the country only give 2% to the mental health care services. So this is absolute lack of capacity for most of the countries. And plus, the mental health often considered as a taboo. I'm coming from East Asia. I'm from Japan. My culture, we don't talk about the mental health issues so openly. And so if I say I feel sad or depressed, family member, they try to hide. And this kind of things, mental health is very like a sensitive topic, very personal experience of climate change. So that's why we wanted to understand what type of vulnerability factors, like water-related things, but also cultural norms and the society systems, and also what type of mental health care services are available, and if it's available, is it accessible, is it affordable? Like these kind of things are so complex and so intersected. So this related to this, we are also trying to look into how this is impacting a young population, like children and also like youth generation. For example, like I'm a psychologist, and my former colleague from my previous work contacted me. Her colleague, the son, 14 years old, told mother, so he doesn't think he can survive after 50 years old. And he's only 14 years old. And he thinks because of the climate change, he cannot survive more than 50 years old. That was so shocking experience for me to learn, because this child is living in the Netherlands, which is quite, wealthy, and also healthcare system is quite well established. But then still, children suffering because they don't know how to act, what will be so uncertain. So this kind of things we need to protect, but also we need to empower younger generation, but also the people who are suffering right now. So the possibly third one, we are, they're trying to understand opportunities, what we can do. We know so much challenges, but also we need to take this as opportunities. We are looking into how AI and the digitalization can, predict and also like expect what type of the, mental health impact is coming up, because you can also map with the sentiment of social media, Twitter's type of the text messages to analyze the population's, mental health, the conditions. And then this also can give to the public sector to make the swift and appropriate interventions. And another thing is also we are trying to understand what type of climate education we can establish, give right tools, tangible the action. This is very important. And so the last one I quickly give is this October host network. And this is open network. Everyone can join and participate. And this is focusing on climate change impact on mental health in Europe, but also we are trying to look beyond Europe, many different regions. So if you have a chance, please have a look. And I would like to also give you the link of the first one is the policy brief series we published, and the second one is for the cost action network. When you have a chance, please look at it and then also like get in touch with us. Thank you very much.
Thank you, Sunny. And I think since you brought the point of climate education, advocacy, outreach, understanding at different levels, I will now take the opportunity to ask Asia, our rep from her work in UAE, but also in Europe. Can you share some insights from what work you're doing in climate education, especially in the mental health domain?
Yes. Hello, good afternoon, everybody. My name is Essia Knight-Kassi, and I'm the... Hello, good afternoon, everybody. My name is Essia Knight-Kassi, and I'm the founder of Mental Ed Group, which is a a research and health education group based in the UAE, but we work globally. I'm a behavioral scientist. Together with my team, we look at how do we contextualize interventions so that they are the most effective on the ground there where needed. And that sounds like a lot, but basically what we do is when a government or a private partner commissions us with a piece of research, we go into communities either locally or we have contacts within that community, and we really much look at what is their information need, what do they think of climate education, but also, for example, donation of biomaterials, mental health literacy. What we do is we collect that data and we design an intervention and we co-create. So we create together with the people that actually need to use that intervention. And when we do that, we understand that when we want to implement that intervention, it becomes more sustainable, because those who need to implement the intervention are basically co-authors, they're co-owners, and they take it as something that they've created for themselves, for their communities, and therefore it's sustainable in the implementation. I think very much in the face of the climate change, we need to understand that it's time to address mental health. most bigger partners and high-level talks are mostly about what do we do about the emissions, etc., etc. What we don't really talk about as much is if somebody drought or excessive rainfall loses their first income, livelihood, what does that do to the main earner, and what does that do intergenerationally? If you lose this piece of land, you've lost generations of land, and it's really, sometimes it takes generations to rebuild that. So what does that do with mental health of youth that still needs to live in those conditions? And in the bigger scheme of things, how do we answer questions like what part of it is our responsibility, and how can we answer that question for us and for those local communities? A mental ed group is very much we visualized our research outcomes. So when we've done the research, we go back to the community that we conducted the study in, and we think of activities to visualize the outcomes. So we take into consideration all literacy levels. How do we disseminate this study? How do we make sure that whatever we want to educate in, it goes through all literacy levels? And how do we attract gatekeepers in that community to help us? So
Thank you
that's
so
what we
much,
do.
Asia, and I'll come back to you. Now I will shift my attention from global and European context to the Asian context. And I have two gentlemen on my left hand side, one from India, one from Pakistan, both the countries dealing with drying conditions, with desertification and land degradation. So I'll take them and put them on the spotlight. I'll start with you, Atif. You've been working both in the Middle East but also in India, and you have worked with communities, other stakeholders. Would you like to share some experience on how you see this nexus between climate crisis, land degradation, and mental health, psychosocial well being? Is there some discussion at the community level, at the policy level, and the same for you in Pakistan context, Irfan? So please take a chance to comment on these points.
Thank you, Nidhi. Uh, Talking from the Indian perspective, like specifically, India is a large country, and we have different landscapes, and the farmers, or we talk about the droughts or the disasters which we have right now. It has so many, I mean, different levels of things happening. Talking from the regional perspective, Maharashtra and Chhattisgarh has been like two-thirds of the states have been occurring the droughts from the 1980s, and then we have been seeing so many challenges. But then, who is the people, the who are more affected, and who is at the loss at the end of it? It's the farmers. And although we are talking about farmers, although we are talking about policies, but then how do we generally like have the solution where we are able to give them with a solution than just talks and policies? So that is a major questions we have been facing.
Is there acknowledgement of mental health and distress among these communities?
Yes, definitely. I mean, mental health has been in talk, and also there has been acknowledgement, but then the awareness level to the grassroots has not been reached. That they do not, even though they are feeling stress and anxiety, but they are not able to address it, what it is, and like how it can be resolved.
So we have a loss of agency.
Yes.
Okay, I'll shift the attention to Pakistan, Irfan.
No, thanks for the question. No, definitely, as you mentioned, I think same the scenarios in Pakistan. I think still a lot need to be done to kind of recognize psychosocial support, or at least first to recognize, Sani, as you mentioned, a lot of young people and a lot of affected people, not usually kind of open to talk about it, which really need to be talk about it. And unfortunately, in conferences like this, also there's not much focus on well-being, on mental health. And if we see all the processes, the negotiations, so and all the documentation processes, so there's not much focus being given to mental support, which I think it's really really important. Why? Because we'll give you an example of one of the region where my organization is working. It's more in the northwest part of the country. It's called District 3. And in that area, being vulnerable to drought and also to desertification. So it's mean the community who are dependent on agriculture. And if we talk about our all the country, so Pakistan, 70% of the economy or the livelihood is actually based on agriculture. and 70% of the people are dependent on agriculture. So it's a big one, not to the economy of the country, but also to the well-being of the people. But due to climate change, we are actually losing our fertile land. The drought it's common, desertification is common, which mean that the people are losing their livelihood, which mean people are losing the support they are getting, which lead to malnutrition, not just in youth but also in children. It also disrupt their education, because in many rural areas, when drought or desertification happen, so it's lead to migration. So people move to big cities where they, so if they move to big city, it's mean there's the loss of education, there's the loss of, most important, their social support which they are getting back in their villages and community, which directly lead to anxiety and depression. And it's actually been getting I would say a main issue these days. People are moving, leaving the areas where they're living in. I will give an example of my own. We also leave our area, our village where we're living, because of desertification and a drought situation. To sum up, I think it's really important, because it's gonna unfortunately get worse day by day, with the climate impact, with the scenario we are seeing. But are we really recognizing it? Are we really trying it to make it the process of those negotiations?
Well, thank you so much for giving us an overview of how localization of this nexus operates and manifests. Well, I'll take a quick round with my panelists again on 2 points, and then I'll open this for the audiences, because each one of you represent a constituency, a region, a community, and you must have observed or reflected on this nexus in that domain. I'd like to touch upon the word that you said, intersectionality. Intersectionality is something that we need to take into account, because the climate change, mental health, land degradation, mental health nexus impacts different communities, different age groups in a totally different manner. And I would like to take a very quick reflection from you, Sane, first. If you can comment on how young children are specifically impacted. You did mention about your colleague's son, but with the lack of agency, which school is a big agency in a child's life, and how do you see diversification of an agency to support that? And to you, Asia, I mean, what are you doing in terms of creating content or working, lobbying with agencies like maybe community-based organizations or schools to see that this understanding penetrates in the education system? And then I'll come to you.
Okay, about the children's agency. So the young children are like developing their, cognitive mind, how to handle stress and how to make life decision, but also how to interact with others. And this in psychology called agency. So how they are they are in power of making their own decision or own feelings. So this, children develop in the early stage. And then this is very important to be supported in terms of climate change, because climate change is so big, so huge, and then it's so uncertain. So that's why gives population anxiety, anxiousness. So that kind of things interrupting their like healthy psychological development. So that is very very crucial. So that's why in the very beginning, like from elementary school, like primary school, under 10 years old, need to give a safe space, and then they can share their feelings with the parents and teachers. And then from the after 10 years old become teenage, they also start to develop their own identity, and that also again need to be supported. And so that's need to be very very embedded. How this population, young population, can do with climate change is very important.
Yeah, I would. In the sorry, the mic isn't working. So, in terms of education, I think we don't have a very clear grasp now as to what do we actually need to teach them and how are we going to teach them. Last year, I ran a pilot for our mental health literacy program in a very diverse international school in Abu Dhabi, and it's called Heads Up. To actually really put your head up, but also a heads up towards the government and saying, if we don't address this issue now, then it might not be addressed until it's too late. What we saw in the preliminary results in questionnaires and focus groups was that climate and eco-anxiety wasn't even a topic. So how can we educate some... sorry, it wasn't a topic with the school. It wasn't part of the curriculum, other than if you had a couple hours left a month and then you just joined the, eco warriors, etc. So my question really is also a little bit to you: is how do you educate on something we don't educate on until we might find that sometimes we're already actually a little bit too late, as with we've done in the global health, the whole public health sector. um, in the Netherlands, we are finding that more and more, obviously, we have weekly sittings on the highway, so that sort of highlights the point. But more and more, we find that students want to be involved in that discussion. So they are claiming their space, they are claiming their voices. In other countries, but still in the preliminary results of our program, it was very much, oh, you live in a wealthy country, be it the UAE, be it the Netherlands. What are you on about? Climate change and eco anxiety is for the global south. And if, as educators and school leaders, we still sort of have that concept, we only educate on technicalities, then we don't. It's my belief as a researcher, but also as an interventionalist, that we won't be addressing this heads on. We will do this when it's way too late, and then all of us will look back in a decade or two, and we say, "Oh, we coulda, we shoulda, but we didn't we?" And that's what Mental Ed Group and the Dutch government and those who I work with in the UAE really strive to get in front of.
We reckon your point that recognizing the importance of local knowledge initiatives and leveraging the local community
Sorry,
support.
can I add one? Very quickly, within education, it's very important. We recruit math teachers for math. We recruit English teachers for English. But who are we going to recruit for climate education? How do we
Absolutely.
professionalize him? Exactly, exactly. And we co-create grassroots level up with experience. But if schools and school leaders don't understand or recognize that lived experiences is an experience, is a form of knowledge, then it's very difficult to come to an education, to a curriculum that's being adopted and accredited, to actually scale up into the global population.
Well, yeah, that's a very good point, and I'm just in a minute opening. I like to shift the focus again to South Asia, because we have also seen the gender disaggregated impacts of land degradation, climate change, and mental health. In some societies, mental health is a taboo, where we have observing the case of Bangladesh, we have noted that women at least talk to their neighbors. They have some time to maybe talk to their relatives, their neighbor within the household. But for men, it is a bit of a taboo to talk about a condition or distress they feel, maybe working out in too much heat, maybe getting exposed to other kind of impacts, where maybe loss of livelihood, loss of income. There is no agency for men per se to talk about the distress they face as a result of these cascading impacts. So I'd like to give the attention to both of you. Have you noted that we need a more of a gender disaggregated approach to address this nexus?
Well, definitely. While we talk about gender equality and the consideration of the both all the genders equally, but then there is no system in place, specifically if we talk about South Asia, and because the taboo of mental health is something like you don't want to talk about because you will be getting judged. So in that process, and then also the data collection or there is no policy in place to do that, and also like being a man or not being able to openly or freely discuss or talk about my own situation to somebody, sometimes it's quite difficult. And
Okay.
if we, just one last
So
point.
safe spaces for different stakeholder groups and different more.
Definitely, and specifically the marginalized people, the people who supposed to be more represented and be in the spotlight, but they do not have even access to information, or economically they are not having the options to do that. So yeah.
Yeah, very good point. And in the case of Bangladesh, the literature published from the country, we have also feel that men also perceive risk normalization more quickly than women or other stakeholder groups, because they have to deal with it. They have to stand up next day and go and look for a solution or look for alternatives to support the family. These are socio-cultural norms, socio-economic conditions that we have to be sensitive to design solutions. And I'll ask you, Irfan, do you have some perspectives on this point?
Yeah, sure. To add what you just mentioned, I think first we really need to recognize this in as a real issue, which is growing day by day. Unless and until we didn't recognize it, we can't address it. No, so recognition is the most important. That it's definitely an issue which need to be addressed, and it's going same. You know that taboo topic. Still, no one is in talking about it, which they really need to do. And why, you know, based on all the information information you gave, I think that this is important, that we recognize it and also try to do more advocacy, you know, awareness. You mentioned, I think it's really really important that within the society, within the community, we bring more awareness. We try to kind of do more advocacy and bring this topic, you know, to the discussion. And Nidhi, back to your point on norms and values, you know, I think in some culture, you know, it's a big tribute topic, you know, because no one want to discuss about it. Why? Because then you will be tagged as, you know, someone with having some issues, which I think is uh, I would say a big challenge, you know, because with the time passage, it's gonna getting worse and worse. So I think the recognition is the most important part. But unfortunately, the community I'm coming from, the region I'm coming from, still a lot need to be done to recognize this as an issue.
So, all right, acknowledge and address and design actions that suit a particular context and society. Well, I think this is a good point. Before we have the closing round with the panelists on future possibilities to address this nexus, I would like to open the floor and ask the audiences to share some reflections on the topic. If they have encountered a similar kind of settings in their country, in their community.
Thank you very much. I am actually from Afghanistan, and you may know about Afghanistan and how we are suffering the same issues. Well, as for the topic, it was interesting because in Afghanistan we conducted a research recently, and I am leading a climate change focused NGO. So we find out that rural communities, especially those communities which they do not have access to basic services, especially health services, we found out that the people who are suffering from droughts, who are displacing, who are migrating to another countries, who are facing with the poverties, who lost their homes, who lost their crops, who lost even their yields, that was a little bit difficult. And of course, this impacted their health a lot. But to mitigate these issues, we were searching to find the ways. We were searching to find local solutions, but it was a little bit difficult because we need resources. We need not only public awareness can support them, but beside public awareness, we need to support them. Additionally, we need to find at least healthcare facilities for them.
Thank you so much for sharing the experience from Afghanistan. So we need financial capacity, technical capacity, and human capacity.
Hi, my name is Brett. I'm from the US originally. I've spent the last 12 years as a nomad, very little time in my home country. So I run into people. I consider myself a planetary level mental health reformer based on lived experience and also psychosocial rehabilitation training. So I've been on both sides of the aisle of receiving services, quote unquote, and providing them. A couple questions. One, thank you for using the word co-creation. I'm actually a co-creation specialist. I wanted to know in your organizations how many of you hire and or include peers or people with lived experience. So that's question number one. Question number two is, how serious are you? I'm going to get emotional. How serious are you about making these changes? Because there's people like me who don't work for organizations and don't have resumes or fancy backgrounds who actually have solutions to everything I've heard you talk about. It requires an immense amount of creativity, thinking outside the box, and listening to people who have these experiences. Now, I'm particularly talking about people who are already diagnosed or having the experience of what we call perceived mental illness compared to future people who suffer based on climate. So I want to acknowledge that, but it's still related. So those are my two questions. How serious are you? And if anyone's truly serious about changing this on the planet, I'm more than happy to give some ideas and try to support all of you in really thinking outside the box. And I beg you to please think outside the box and please listen to people like myself. If it's not me, find some other people. Thank you.
Thank you.
Yeah,
Respond.
I would like to respond to that. How serious am I to make a change? Well, I'm born and raised in Amsterdam, but I come from a Moroccan immigrants. So my parents migrated to Morocco. We are from the very south end of Morocco, and my parents left because of drought already so many years ago. We lived, although in the Netherlands, in what you can prescribe as poverty, but my parents always choose school over anything else that costed money, and school doesn't cost any money in the Netherlands. That's the one thing you get from the Netherlands, is free education until you're 21 or 22, or if you go the doctor route until you're 30. And how serious am I? I founded Mental Ed Group because I lived in Bulgaria, I lived in Vietnam, I lived in Turkey during the Syrian refugee crisis, and I live in Abu Dhabi for the last 10 years. I have rolled out numerous of community groups, workshops, talks throughout schools without ever receiving any payment for them, because there was never enough budget. For me, there was never enough budget. But for other bigger organizations there was, and I took it in stride because I knew that I came with that lived experience. What does that do intergenerationally, and how can we co-create? My slogan is, I educate this generation for the next, and this is my son Isa, who I brought here to have his 3 minutes of what climate change does to him in the youth hub. And again, we're not funded, but we do everything ourselves. And why? Because I'm not the only one that grew up in poverty and who used school as a get out. I'm not the only one. I will never be the only one. And across the world, more and more so, we're going to do that. One of the most striking things I witnessed in my life that actually had mental health effects for a good period of time was when I was in Turkey, and we were actually fundraising for Syrian refugees on the street. It was harsh in Istanbul winter, and I used to work with this family. And a couple of weeks later, I came back. I was visit them every week, and their baby passed because of the cold, and they didn't have anything. And that really sort of, and I thought that baby never had a chance, and that isn't something that that baby did. My parents didn't have a chance in the south of Morocco out of their own faults. So I think what happens to most of us in most of our communities, it's not our fault, but we are expected to live with it. And I used education as a way out. I recruit my people are all from the backgrounds that I have lived experiences. I tend to ask for money from the Dutch government and the UAE government where and when needed. But what we do is we educate, because I feel and I believe that eventually, rather than throwing a lot of money, when you teach somebody how to, I think that the saying goes, when you teach somebody how to fish, you never have to give him a fish again, or something like this. And for a very personal religious reason, the first word in our book is read. And I took that in stride and said, if I know how to educate myself and get out of this situation, I can teach others how to do that and get out of their situation.
Thank you so much. Can you make a brief intervention?
Okay. How serious am I? So I'm really serious, and I have been together with several colleagues of our institute, but also beyond, try to raise awareness. But also some of you mentioned awareness. Only raising awareness is not enough. We need some action, and that's again like coming back to the about budget and the funding. And this also we have been struggling, as I mentioned earlier. Like formal healthcare sector is limiting the investment to mental health sector. So this is really, difficulties. Even like, someone who is open about their situation, reach out to formal, counseling or psychologist. You need to wait like a couple of months to see the doctor. So this is the situation even in Europe. So that's why, we need to do the bottom-up approach. Like climate education is definitely key. And, school and this type of the safe environment should be the, like the fertile ground for facilitating people to come and share the feelings, and also like support the parents and teachers, because I myself also have a child, and then I also deep in my heart. I don't know how to explain about climate change to my daughter without hurting her, without scaring her for her future. And this also I hear from other parents, the parents and teachers. They are also concerning how they can tell about the climate change truth, but without scaring them. Like, the whole entire population need to have a right education, right understanding of climate change and what we can do next. This really like bottom up, step by step, but we need to move forward. We cannot stand still. We need to walk towards together.
Thank you, Sunny. I think you want to like make an intervention on this. So can
I appreciate asking you the question, and it's really important what you have mentioned. When we talk about our region, it's not that we want to solve a problem in just one region or one country. It's all the people. It's all of them, because we have only one planet, and everyone has to have their solution for the problems. And yes, governments can fail us, policies can fail us, the rules and regulation will fail us, and you are already suffering from something. How do we address that? For that, I'm just going to take a small example from India. We have a community programs in India. We have like organizations. One such, we have colleagues from Heartfulness Center, and such as, and there are others as well. So who are doing a great job. Like that's why I am building a platform called as Planet Pact, where I bring these organizations together, where they address solutions and also learn from your experiences, the problems you are, or me and all of us are facing. So we will definitely take the inputs, whatever you have. It's invaluable to me and to all of us, definitely. And then we would take the input, and also like how we can best help you and support you would be open to that discussion as well. And in general, to all of you.
Thank you so much. Well, I'm just coming back to you. I think we also want to add that mental health in this discourse of land degradation, climate crisis, climate action is a very new entrant. We have been, after in Sharm el Sheikh, we had a couple of sessions to bring it to the front with WHO, with other agencies who are spearheading the health agenda in the climate discourse. With UNCCD as well in Dubai, we had a dedicated session on droughts and mental health nexus, with representation from small island developing states, with Middle East partners, and many other experts and agencies. So slowly and gradually, we are taking steps to understand that to understand, lobby, and advocate for mental health integration in land degradation policies, but also in climate action policies. This is not an easy challenge. Well, but Dubai did give us the climate and the health declaration. At Dubai, we had a vast representation of the health ministers from many countries, member states of the UN. Well, that's a kind of a promising pathway to give us some light that health and mental health is going to be the focus of climate policies, of environmental related multilateral agendas in the coming time. So we are moving up with a very promising spirit, but we have to do our part. We have rights, but we also have responsibilities. And I'm glad to know that things are happening at a different level in Europe, in Asia, and these are references that we will present in high-level political forums to nudge our policymakers to take this seriously, to dedicate financial resources, to dedicate to build a capacity of stakeholders who can be those leaders or champions. And would you like to just share your point in that context?
So, good afternoon once again. My name is Mikael Harunada, and I'm from Nigeria. So, I'm from Nigeria, West Africa. Drought is a major problem for us. Uh, we used to have the 11 frontline states that are affected by drought. Now, drought has affected most part of Nigeria. To be precise, the 19 northern states. We have 36 states. You subtract 19 from 36, you have 18. So we are saying that we have maybe 60% of the country is affected by drought. So in 2012, I did my undergraduate project, and it's on the socioeconomic impacts of climate change on a semi-arid ecosystem. During my field survey, one thing that came to the front burner was the rate of divorce as a result of drought. So when people lose their livelihood, when men cannot afford, there is always problem in the family. And then divorce come in. But that's not really the problem. It has a domino effect. In that after the breakup of the family, then the mother or the father will move to another location. He will mix with other children, and then we'll have children becoming delinquents. This affects the family, it affects the psychology of the family, the mother, the father, which brings us to the mental health issue. Another very important example, and I'm happy my brother Adewumi here is here. I met him in 2013. So the first time he met me, he said, "My brother, how can I take care of this issue that is really affecting me?" I told you earlier that drought mostly affect the northern part of the country. Adewumi here is in the southern part of the country. His location is mostly forested. So the problem, if when there is drought, when there is no water, the pastoralists will have to migrate to the southern part of the country. And that is when the problems with Adewumi have. His own plantations, his own farmlands are then being affected. Then there comes a problem where Adewumi will be depressed because he is helpless. He doesn't know how to solve the problem. They too, they are depressed, they are helpless because as they move, they are having issues of conflict that they are helpless and they can do nothing about it. So, in emphasis, what I'm trying to emphasize here is there is the need for participatory planning. When we talk about stakeholders, stakeholders don't have to be in New York, don't have to be in Riyadh, do not have to be in Abuja. The stakeholders, the real stakeholders, when we talk about drought, are in the local communities. Unfortunately, they don't have the voice. And then when we talk about education here, they don't have the technical wherewithal and the financial resources to solve their problems. So we need to do more of that in order to address this issue. Thank you.
Well, thanks for sharing this very localized context from Africa and also bringing the African voice in the discourse. We really appreciate it. And one of our colleagues, and we worked together with him, Dr. Ken, is not able to join us in person today. He works with Imo State University, and he's working at the community level to understand local and traditional knowledge and practices that can be used to stimulate mental health related interventions. So not taking practices from Europe or from US, but utilizing indigenous knowledge and local activities to mitigate mental health impacts. Yes, the research group, absolutely. So I think the idea is for the research people in the university to work closely with communities, impacted communities. I think the partnership between academia and community is also essential. So we can research and we can produce evidence to influence policymakers. The policymakers are always after evidence, and the research institutions like universities can give us that. Would like someone like to make a very quick intervention?
No. First of all, thanks for the intervention. I think you highlighted a very important point of localization and participatory approach that we really need to do. Like someone, as you mentioned, sitting, let's say, in country A and planning a policy for country B, which don't have the real flavor of what is happening on the ground. So it's really important that we should have a participatory approach. We should have the local lanes, also taking care of the local culture, norms, and values. That what are they seeing, and to co-create the different solution we have. But for that, it's important. Awareness is really, really, really important. Recognition is important that this is an issue on the ground, and once you recognize it, when there's enough awareness, the next step is to co-creation with a participatory approach. That's really, really important. And most another important thing is multi-stakeholder engagement. Academia, private sector, public sector, NGOs, INGOs, UN system, that all should work together. And maybe a last thought, also we need to I think there's a question how serious we are to tackle these issues. One of our colleague asked this question. So I think there's some sort of indicator we should take in place. First, for example, if you go to a conference, scan the agenda and see as there is something happening, there is an event happening, or there's a dedicated day on mental health. So I think that could be one indicator. Another indicator, how much finance is flowing into these issues, how much project is happening on ground on these issues. So I think these are some of the indicators through which we can see, are we really serious to consider these issues and not? And unfortunately, I think at the moment, we still need a lot to do.
Well, we don't want to end the session on a depressing note. So we are going to have a very quick few seconds for each panelist to give their comment on emerging technologies that hold potential to co-create solutions. And I will point to at least one such technology, artificial intelligence. How do you see that contributing to mitigate and unpack the nexus between mental health and climate change, land degradation?
Although there's much to do about artificial intelligence nowadays and how much we might use or misuse it, especially children. Look at the bans in Australia, etc. It actually gives us a very good insight into what we can do to really fast scale up and educate people via apps, localize, pinpoint, for example, in areas where physical access is very difficult. So in that regard, we can use it, and I think it would be actually quite foolish and naive not to, because that is also the world we are transitioning in anyway. So taking them into that transitioning, in that transformation, is what I believe that the way to go. And scalabilities are amazing.
Absolutely. I'm glad that you see AI as a friend. How about you, Sane?
I agree with you. I think we should utilize this AI and the different types of digital technology, advanced technologies. But the important thing is like security, like data security, because you are dealing with such a private, personal information, such like mental health related things and health data. So that's why need to be done in the more like private, public partnerships. The platform should be very secured.
Oh well, any remarks from the men this side?
Well, with technology and especially being a technology consultant and seeing the AI being changed in everywhere, obviously our colleague mentioned that data privacy and data security be an issue, but then it could be a good thing and a bad thing at the same time. But then how we modulate and regulate it, that would be the question. And rightfully having a platform where AI could be the change maker, whether it's mental health, whether it's drought, or whether mapping of the data and also processing it, and to be able to give it out to the grassroots organizations to use it, first of all.
So yeah, if we talk about technology and AI, I think social media could be one of the platform. A lot of young people are there. I think everyone is using either Twitter, Instagram, Facebook. So I think that could be an important tool that we can really use, not to identify the issue where the issue is, but also the solution. There could be a online platform where the affected people can come together, can discuss the idea. And back to your question, to make it more participatory. You don't need to bring them all in person. You can do it virtually. So I think social media could be a key tool as well.
Thanks, Irfan. And I do also like to acknowledge that AI can be harnessed at least to generate broad trends, to be able to use phenomena like digital phenotyping, where everyone now carries a digital device, whether it's some tablet or a mobile phone. And if there could be some kind of ways to cache that data, interpret it without compromising the identity or the privacy guidelines, and we can work towards innovations that allows us to do so, I think that would be a win-win, because we are harnessing the technology to a positive outcome, not seeing it as a friend. And I think also one of the projects that we are now started to work on, which I would like to, of course, invite all of you to join, is AI-based storytelling for bettering the mental health outcomes of climate change and environmental degradation. So you can use visualization as an exercise to engage, especially with young generation, to be able to influence them with scenarios, plausible scenarios, possible scenarios, bad scenarios, business as usual scenarios. So I think with that note, I'm sure that you at least got some insights on how this nexus operates, what kind of operational mechanisms can be used to mitigate the challenges we have on hand, and to hear diverse perspectives from the European side, from the Asian side. And we look forward to continuing the dialogue in more such forums, and maybe seeing some of you in Belém, Brazil next year.